So I just want to thank everybody for coming tonight to Community Conversations. I'm excited to have you guys here. We're going to talk about some interesting things tonight. So I'll talk to you a little bit about what we're going to talk about, and then I would like to introduce Marika and some of our team members that happen to be here tonight. So tonight we're going to talk about change, and that change in correlation with healthcare, change personally for the population, our community that Hestia and Home Support is looking to cater to. And we would like to open that up and see what you all think. Marika just wrote an article about bringing our 60 is the new sexy, so we might talk a little bit about that tonight. So what I would like to do is, before I bring you into Marika's talk, I would like to introduce our team, and I'm going to start with Mary. If you could just say your name and what you're doing with Hestia, that would be great.
Yeah, I'm Mary Werner, and my contribution to the team is looking into the realm of spiritual care, and one of my tools is the harp.
Thank you, Mary. Caitlin, do you want to go next?
Yeah, my name is Caitlin Wood, and I am a carer, so just helping out with daily needs and whatever anybody might need help with.
Recently got into nursing school. What? Congratulations. Emily.
So my name is Emily, and just like Caitlin, I'm one of the carers. So her and I are working on that same front to be there for those daily needs of our clients and patients and humans, if you will.
Thank you.
And I'm Karen, and I'm a dental hygienist, and I'm going to be working to try to assess the needs of maybe people that are homebound or cannot get out to have their regular dental care, and help them to set up some kind of a home care plan for them and be able to assess their needs and maybe get them referred to a dentist if need be. And I would be the one that could actually do their cleanings at home, and then hopefully be able to help them understand how dental health can contribute to their overall general health. So there's a direct correlation between disease and heart disease and diabetes, and so hoping to help out people that way.
Geez, how homebound do I have to be for that? Sounds pretty good.
We'll have to figure that out.
Steph, you want to go?
I'm Stephanie, and I am the Community Outreach Director for Hestia, and I help with the marketing and education of who Hestia is and what we are doing.
Lisa.
I'm Lisa Labor, and I'm the life coach. And so I have the opportunity to work with both staff and our patients and their families with some coaching and keeping a all-around positive vibe going.
Thank you. Mm-hmm. Thank you for introducing yourself. So I myself am Tanya Chandler. I'm the Chief Operating Officer for Hestia and Home Support, and my job and goal is to carry out our mission and our vision of Hestia. So I'm going to now introduce our Chief Executive Officer, Marika Moore, and owner. This is very much her vision and her baby, and we stand beside her in this really amazing journey. So, Hestia really is Marika's baby, and I'm going to let her talk a little bit about that.
So one of the things I wanted to talk to today about is change. So all of the change that we experience in our lives. And we had this incredible speaker come to our site and talk about change about driving. So as you age and drive, there is a 50, is it after 50 class that you can take that you can learn how to be more responsive as you are aging and driving, and how he felt that it was really important to do that in order to manage that so you could keep driving for as long as possible. But he really correlated that well for me when we were talking about aging and being in your home and maintaining your independence and having your needs met in a way that was meaningful for you. So that's something that I really wanted to talk to you about today. But I want to go back a little bit and talk about why Hestia and how that started. So Hestia is an idea that came from my good fortune of working with Hospice of Missoula, who's hosting today. And Kit Jackson is the owner of that, who's also my mom. So I was really lucky enough to be able to work with Hospice for 12 years off and on and learn about what that was and how it's such an amazing gift to give to people in the home at end of life, especially when they had no idea that that support was even available. And what we saw a lot in that field was that people would call us for that type of support when they'd heard from it from other families, and then Medicare wouldn't qualify them to pay for it. So someone would come to us and say, hey, this was so great. We heard that Bob had hospice. You provided the support medically that he needed in the home. Could we also have that? So we would go out and meet with the family in their home, and we would say, you know, I can see that you need support in the home, but according to Medicare, they won't pay for it. So Medicare doesn't qualify you for hospice. And that's really disappointing when you're a caregiver or if you're part of a hospice team and you really want to deliver care into the home for somebody who needs it. And we saw that happen a lot. Of course, we would try to piece together teams for them. We would call other agencies in town, get them into an assisted living if needed, sometimes a skilled nursing facility if that was needed. But this was something that we identified just locally that was a need, definitely for people. So then last November in 2013, so not the one that we just experienced, I went to CAPC, which is the Center for Advancement in Palliative Care. They had a conference in Texas, and there were 500,000 people there from around the United States, and they were talking about palliative care. And what they were addressing was the same need, that there are people sort of in this gap that need care, and there's nothing in our communities that can catch them during that time. So you have, say, a normal disease progression, so something like diabetes, and it seems to, be something that your physician can manage, and as you age that probably gets worse. You see them more frequently, and then it gets to a place where you're in and out of the hospital, and then before that's something that you would go to hospice for, there is this place where you'll be calling the ambulance, you'll be in and out of the ER, you'll be in the ICU, and during that time, you'd rather be home, right? Because that's expensive, first of all, and you'd probably rather not be in the hospital. If you could call somebody and have them come take care of you in the home, that would be better. Well, at least for me. Some people like the hospital, but I'd rather be at home. So that was something that people identified during this conference. And so everyone was there trying to figure out how that was a sustainable program that we could offer that Medicare would pay for. And the answer was like, there's not one in the whole United States that's sustainable of anyone who was there. The most sustainable would be something that was operated by nurse practitioners, which would be a mid-level program. They would go into people's homes and take care of them, probably saw them once every other month. And that's a really good thing. It was a great thing. But because I was from a hospice background where it was an entire team that did holistic care, not only talked about, their bodysuit, like the physical body, but also talked about them emotionally, spiritually. How are they doing as far as being independent? Are they living the joyful life that they want to live in their home? I'm used to that. It's a model that I love. But there wasn't a way to do that with Medicare. So I left that conference sort of feeling defeated. It was disappointing that there wasn't something out there that I could put together easily. And so that's how Hestia was sort of born in my mind, was if it isn't something that Medicare can do, we'll just create something that's private pay, and we'll try to convince Medicare eventually that this is a great program, and we'll look towards long-term care insurance to see if it's something that they will cover. And so that's what we've done. So that's how Hestia was born, and that's why we're doing what we're doing. And it's something that I'm really passionate about, and it's really evolved a lot. So it isn't exactly what I thought it would be from day one. It's changed as we've been in the community and asked people, what would it be that you would need to stay independent and at home? What sort of services do you want? And that's been really fun to see. People really joyful to be able to stay at home and have those things brought to them. And it's not always that it's a carer, and it's not always that it's a physician. It's not always that it's music. It's different for everyone, and they get to tailor that program to them to decide what it is that works for them. So that's a really fun part of what we do. The other piece is that we're not limited by anything because we are a physician practice and we are under a physician's license. Everything is under that plan. So we're under the scope of what a physician can do, but we're not limited by anything. So if you wanted us to bring you Starbucks every day, we would do that. So if you wanted us to have a hygienist that would come to help clean your teeth, we could do that. So it just depends on what's important to you, and our goal is to keep you in life. You know, not for you to be isolated or for you to be scared or for you to be worried about what your kids are going to make you move into because they're scared that you're going to be at home by yourself. You know, you want to be in control of those choices, and we want to help you do that well. The other part of that is that your family's really happy then too, right? Because they know that you're taken care of. So they don't have to worry, and they're not going to be an advocate for you moving, and they're not going to be in there making those decisions for you. And that was the part that really hit home for me when we were talking to Mr. Mormon, who is the driver guy, was that if you don't make those choices for yourself, there will become a breaking point that someone else will make it for you. And how many people are going to know you well enough to make that decision the same way that you would? I mean, probably no one, unless you've really been clear in writing it out. So I think that it's really important that you start to make those choices and those decisions on your own, and that you have an advocate that can help you do that well. So part of what I wanted to do today was to ask you guys what you think about that, and if there are pieces of that that are interesting to you that you think could be developed, if there are things that you think, that would be a horrible thing for me to have at home, or if there's something that you would really love in that way. And also for you to understand what that looks like from someone who worked in an assisted living. So that's Tanya's experience. She worked in an assisted living building and did see people who lived there and what was their need. You know, how did that look when they came into an assisted living? Was it a choice that they liked, you know, always, or was it just sometimes? How did that go? I'm always sort of surprised when I talk to people about Hestia or any sort of care that you would get as you age, that it's something that you have to pay for out of pocket. The general assumption is that your insurance will cover that, or that Medicare will cover that, and that's just not the truth. And so that's sort of a hard thing to tell people, but it isn't what goes on. And so I think when we have more conversations like this, and we can all sort of understand what that looks like, we can tell more people, and it won't be so shocking. You know, we can plan for what that looks like, and we can have an idea of how to support other people as they go through that process. So I would like to let Tanya talk a little bit about what that looked like on her end. As people were coming into assisted living, she worked at Village Senior, which is a very nice. It was all independent living at one time, and while Tanya was there, they took it to all assisted living so they could provide care that people needed in order to age in place. So if you don't mind, that would be great.
So first I want to just back up a little bit and talk to you about my experience prior to working at the Village Senior Residence, which is now currently an assisted living. I worked also at one of the Gunman Group's other facilities called Hillside Healthcare Center, and I was there for 4 years. And one of the things that I saw there was these very ill people coming in to the skilled nursing facility and being so upset about that decision. And that decision was just, it was never a really pleasant transition from wherever they were into a skilled nursing facility. And that was always sad. And I hated that I worked in a place that it was such a negative piece. And it was like, well, we're trying to help, but people wanted to be in their home. Bottom line is they didn't want to be in a hospital or in a skilled nursing home. And so after 4 years of being in this particular facility, I then moved on to the Goodman Group's other facility, which is at the Village Senior, and moved into an assisted living. And I was really excited because I thought, oh, this is it. Everyone's going to be excited about moving it because it's not a skilled nursing home and it's not the hospital. So of course, this is Village Senior is beautiful. Everyone, you know, it's a very, very popular place to be for elderly. And again, I was disappointed. Generally, people were not mad that they were there, but they were not happy. They were not happy with the fact that they had to leave their home at this late in their life and make this big change and detach from everything they loved so that they could get the care that they needed. It was really sad for me because I thought that I was going to have a little bit of a different experience, which it was. There was a shift, but it still wasn't exactly what I thought it would be. So when Marika approached me about this idea, I was just like, that is meaningful. And that is something that I have been looking for these people, because how great would it be to say, yes, we can keep you in your home, and yes, we can meet your needs where you're at. I was really excited. It was a big jump for me because I've been with the Goodman Group for 8 years, and they're a wonderful company, and I was honored to work with them. But this has created a whole new path for me, and knowing that we have something in our hands that has a strong potential to kind of shake the nation and their healthcare ways and the way in which they're approaching it. Because honestly, as the baby boomers come, I don't think that they're going to be okay with moving into a facility. I don't think that that's going to be good enough anymore. And so with this beautiful idea, we're going to be able to actually stop what we've been doing and switch gears. Because a lot of the people that I served would absolutely be able to stay in their home and pay for services if the services were extended, meaning those disciplines such as the doctor, the dental hygienist, the nurse, you know, the acupuncturist, whatever their care was really requiring, that, you know, we would be able to do that. Because right now what's out there cannot meet all of those needs. They can meet some of them. There are fractured pieces. There are organizations that do pieces of what Hestia is going to do, but we're really trying to, as some of our directors say, wrap around our patient. And so that's what we're trying to bring. And we're getting pretty excited about it because we also have a vision. And with our vision is that we would like to help people to stop fearing this transition in life. This is a process, and we go through processes throughout our entire life. For example, we go to high school, and then we go to college, and all of those, you know, ebbs and flows. There's some bumps, there's some turbulence, and this too is like that. However, because it becomes more toward the end of our life, we take on, I think, a more negative approach to it, instead of just embrace this process too and make it what we want it to be. So that's what Marika is really saying when she's talking about change, is like, do you want to be in charge of your change? Because if you do, then you can. And that's what we are trying to do with Hestia, is make that possible. And so it's really exciting. So we want to take some fear out of the process of chronic illness, death and dying, just going through those processes, because they are what we want them to be. So with that in mind.
Yeah, it's interesting because we've had the good fortune to watch some people go through those difficult things and see how it can be different with Hestia alongside. So we've had people who are in their home, had Hestia as a caregiver, would need to go into the hospital, but instead of going by themselves and being confused in a hospital setting where the hospital can sometimes take over. I don't know how many of you have been in a hospital before, but I have, right? So I've gone in through the ER. I don't feel well, and so I say yes to everything because I trust them to do what's right, and they do. But I don't have it slow enough for me when I am not feeling well to ask questions, and I sort of feel like that's a difficult thing to do then as well. But when we're there, you know, we're not hurt, and we're there as an advocate. So we've been able to go into the ER alongside someone and to slow that process down enough that we can be an advocate, and just to make sure that what's happening is what they want. You know, do you want these things to happen? You know, what does that really mean? Is that something that will be meaningful to you or not? And that's so cool, because it isn't the way the system is designed. That's not the way that it works well. Because on the other side of that, they're trying to save people's lives, which is also really good. So they're both great, but they're just working like not synergistically always. You know, sometimes they kind of come up against each other. And I think that it takes a lot of thought to make that work well. And so we don't mind interjecting in there, and we have enough experience to go in there with someone to say, you know, I know you well enough to know what your wishes are, and I think you'd want to think about this and change your mind if you want. But let's just ask the question. We can slow it up enough to ask the question, and then you choose whatever you want. And I think that having that freedom to do that, and having someone as your advocate that you can say like, I'm not sure I really want that, but you don't have to tell the physician that, is a really safe thing. It feels comfortable. And that's it's a really neat thing to watch. You know, it's a gift not only to the patient, but it's also a gift to us, because we want to do that. That's why we're here. So I think that being able to provide something that we have seen a need for so long has been incredibly rewarding, and I'm excited to see it grow and watch other people be able to benefit from it. Some people who aren't here today that I wish were, but I'd like to sort of represent, are our medical director. So Dr. Peterson Hale is our physician, and she's also an ER doc at Community Medical Center, and she's just a wonderful person. She also used to be a nurse. So she has a well-rounded background and does visits in the home, which is great. Another person who couldn't be here is Miri, and she's our physical therapist. And she's really great too, so we can also do physical therapy and rehab in the home. So if somebody, you know, wanted to recover in a home instead of going into a skilled nursing facility, they could do that. And she's really amazing in that way. She also operates from a place of being curious, you know, about what the cause is, rather than just saying, here's what we do to fix that, which I think is really fundamental for everyone on our team, and I really appreciate that a lot. I think those are the other two people that aren't here though, am I right? Yeah. That's it, but I just wanted to make sure you kind of knew them through me. I can act like them if you want me to. I'm happy to pretend like I'm them. I always wanted to play a doctor on TV, so I'll do that too if you want. But I would also just like to open it up for questions. If you guys have questions about what Hestia is, or how we work with hospice, or how we work in the rest of the community, because a lot of people are concerned that our physician would take the place of your physician, you know, or that you know, you had to qualify and get a prescription, or, you know, there are a lot of questions I think about Hestia and how to access us. So if you have questions like that, lay them on me. What do you got?
Do you have any connections with the aging services, the one that Susan Kohler runs?
We do. We have a connection with Missoula Aging in the way that we are on their list for referring, but then we also help them navigate some of their processes. So we attend some of their classes, and then we understand their volunteer process. So we have people that are affiliated with us that are in their volunteer program. So they know about us, but we're also, you know, pretty new. So we've only been around since November, but they're a great group. I really am proud of what Susan has done. I listen to her on the radio all the time.
So as we kind of just marinate on a little bit of what we've talked about, I want to talk about and kind of dive into the change, because that change piece that we're talking about really starts with the individual. And I think that a lot of times what happens as we get either sick or start aging is we turn over the decisions to like our children. And I'm not saying that that is wrong, but at the same time, I think it's important to really establish what it is that is meaningful for you and how you want to carry out the process, whatever that looks like. For example, if you've lived, you know, more on a holistic path in your life, but let's say your children are more allopathic, then I think it's important to state those needs to your children. And what we're really trying to do is create awareness around taking a stand for whatever it is that you want from your care in those processes, whether it's chronic illness or death and dying, to really be more vocal about that. It's funny how America is so afraid to speak up about those things, whereas in other countries it's sort of honored and it's a beautiful thing. And for whatever reason, America, it's more quiet and it's kind of like a hush-hush taboo. We don't talk about that in the family. And I don't understand that, because I think without the conversation, I think there's a lot of misunderstanding, and that transition is not smooth, but really rocky. And so if anybody has anything along those lines that you would want to kind of start talking about, I would like to really hear that.
Oh, I do. So my dad recently, I'm sure he won't mind if I tell a story. So he recently was going into surgery, and then so my question to him was, as always a risk going into surgery, if you die in surgery, what do you want us to do? Like, I don't know what your wishes would be. And he was like, oh, I don't really care. Like, do whatever you want. It doesn't matter to me. And I was like, okay, so then a big Catholic funeral, like that's what you're going to have? Because his family's very Catholic. He no longer really is, right? And he was like, no, I don't want that. I'd like to be cremated. And I was like, okay, so we're getting somewhere, right? But he wanted to pretend like he had no wishes about it, which is so funny, but he really very clearly did, but he just hadn't ever talked about it, or he hadn't maybe even thought about it, which I think is pretty common, right? Unless you're odd and you work in an aging industry or you've worked in hospice, you know, you don't really think about what do I want when I'm dead, and will I even care? Because he thought he didn't care until I was like, perfect, that would be such a fun funeral. It'll be 5 hours long in a Catholic church. And then he was like, no, that wouldn't be what I want. So I think that that's part of what we're saying, and I think you can get ahead of the curve in that way. You know, we don't have kids without talking about what that is going to be. That would be really weird to say, like, oh, I'm gonna have a baby, I'll just wait until that happens and then we'll see how that goes. You know, we plan it. And we don't let our kids plan it for us, or our families, or our moms. Like, it's something that we plan, because that's our bodies, that's our life, it's how we're doing that. And it's so curious to me why that changes when we're talking about aging or dying. Maybe it's because we think we won't age or we won't die, and that seems to be what our culture echoes back to us, right? That's not ever going to happen. And if so, like, just go somewhere else and talk about it, because that would be really uncomfortable. But I think that this is a really important time to talk about those things and to really validate other people and accept them for the people that they are inside of that, because that makes it really great for us when we age. You know, I don't want to be 80 and then have that be a difficult thing for me. I want it to be something that's well accepted. And in order for that to happen, I have to be accepting of other people who are going through that process. And that's why we have conversations like this. That's why we get together and do this, because it's an important thing to talk about. So short of marching in the streets, which we could also do, we can get together like this and talk about it. So I know that you have a similar experience with your dad, right? Like, he's...
Well, I was just going to comment on yours. You took the perfect opportunity, which was your dad had probably just signed one of those things on the clipboard over his head that saying that if you die, you understand. It's cool, you know, that happens. But he probably wasn't actually figuring that he was going to die, and it was nowhere in his mind that he could die in surgery. And so you took up the opportunity to point out that, yeah, you know, that could happen, Dad. And then, you know, you got to find out what he wanted.
Right. I mean, my family is not, they know that I work in hospice. They weren't surprised. They know that I'm doing something in aging. It's not like it's a big secret. And still, at family conversations and at dinner, you know, if you start talking about aging or dying, it still will stop everyone quite short. Like, you know, they don't want to talk about it. It's like uncomfortable. It's such an odd thing, but it's true. And I think the only way to change that is to keep doing it over and over again. We have to really be comfortable with being uncomfortable, and that's what will change it. And so we have to be advocates in that way, and I think it's important for us to sign up to do that. So on your way out, I'll be taking blood samples and oaths. But you all do that too.
It's sort of...
Go ahead.
Well, I have a couple of comments. One is I think you're wrong about pregnant women. Most of them don't plan it at all, but.
Well, we try.
Yeah, not in my limited experience. But I'm a little, and I've talked with Monique over the years about this, so I know a little bit about what's going on. Have you shifted the model away from palliative care to a little bit earlier than palliative care? This sounds much more.
No, I don't think so. I just think that we sort of stray away from using the word palliative care because a lot of people are confused by that. So because it's sort of, like if you've seen one palliative care model, you've seen one.
Yeah.
They're all so different that if you use palliative care to describe Hestia, it would be confusing because it's not like anyone else is doing. And because in Missoula there are a couple other palliative care programs, I just would hate for that to be confusing to people. So, but no, it absolutely is. Yep, you're right.
My other comment is not specific to Hestia, but when you're talking about people making choices, it seems to me that, and I'm speaking from myself, rapidly approaching aging, we need to start the dialogue long before you're talking about it.
Right.
For instance, just as an example, I live in a house that if I choose to stay in it, I will not be able to stay in when I get to the point you're talking about. Because, you know, there's mechanical things about this house. Now, I'm aware of that, but a lot of people think that they can just sort of go on living where they are forever and they get a little sicker and Hestia will come in and help them. And it may not be quite that simple. And that's where I see the biggest obstacle in our culture that is so afraid of aging, that we need to be starting a lot of dialogues. I mean, I frankly would move into a really nice co-housing unit right now if it existed, you know. But we don't talk about those things.
Yeah, that's funny because we talked to someone today that was saying, so my whole life I was raising kids and we were always like trying to, like my husband and I were planning to have a house that was big enough that we could raise our kids in it, right? And we're planning to do that. We finally get the house and my kids went to college. So now we have a 5-bedroom house. That's great. It's what we always wanted and my kids are all gone. And I think that that's sort of synonymous with what you're saying. It's like be realistic and like live in the real and the now and like what will that look like? And as you're aging, do you want, you know, multiple stories? Will you want stairs? Will you want all bathtubs and no 0 entry showers? Like, what does that look like? And unless it's a conversation that you're allowed to have comfortably, that people are asking you about, then yeah, it's going to be a tough thing to talk about. But if you can be honest about it, you know, if you're talking about it with your providers and your friends or wherever, you know, I think then that makes it a lot easier. But practically, that would be a difficult thing. I agree with you.
So are you saying is that such places don't exist, that you'd move into one if?
Yeah, right here they don't, they do in other
Yeah.
places, but it's like the driving example, you know, you start at 50 thinking about when you're not going to be able to drive, and you need at 50 to also start thinking about when you're going to need to change houses. And
I see. What do those houses look like this? What does that look like?
well, co-housing is a whole living model, and I don't particularly, I mean, that's a whole story in itself, but at some point, people need to be in areas where they can access the bus, they can get to the grocery store. That's long before they need Hestia.
Yeah.
But they need to be thinking those things through.
Handicap accessible.
Yeah. Our new bus service, which I think is wonderful. There are whole areas of Missoula, if you were 75, it'd be pretty hard to get to the bus most of the time, and it doesn't run on weekends. And
That's so interesting because the city had a planning session for seniors in particular is what I attended. And I went there anticipating hearing the problems I hear from people in the homes all the time. But the things they wanted to talk about were things like not being able to build the alternative dwelling units to have a live-in come and live there, or you know that was being taken away from them because of the college renting situation. And their solution to it was you know, building more communities like that, where all the old people could come live in this area of town because it would be within walking distance to the hospital, and the buses would all go there, and the grocery store would be across the street, like in the olden days when you had a neighborhood grocery store within walking distance everywhere. And first it surprised me, and then I thought, that feels kind of like segregating the city into, okay, we're gonna have the families live here, and the homeless people live here, and the old people live here. And then to come here and hear again like another frame of, oh, that would work for me. It would be
Well,
nice.
personally, I would want to live in one, mixed ages.
Right.
Some people like the ones over off of Reserve, that are limited to people over some age. That would drive me crazy. I like kids running around. But
It's just so
different
interesting.
people have different needs.
Yeah, there's just so many models out
Yeah.
there, and I think what we get used to is the same model all the time, because it's what those of us that have been in Montana a long time have
Right.
grown up in, and those who want to come here just for those things, that they're not going to be bothered. And then to do it like a paradigm shift of, okay, you have a new option now. It's
Right.
really hard to break that mold of, no, but this is what we've always done.
Yeah.
So to try to learn something new as an opportunity, even if you can afford it, that's what's been interesting is I think that this is an opportunity for people who have saved their whole life to be able to do this type of care, as opposed to only having options of moving somewhere. You know, I think that that's the beauty of, I think, the choice.
How well do the long-term care insurance programs cover it?
Depends on their contract.
Do you know what type of things those people are going to, because we're advocates of having these conversations and considering these things. So when you go to buy a long-term care policy, what do you look for? Like what's,
Yeah,
because that's overwhelming. I don't do that well, and I'm young and college educated. I can't imagine being older and trying to catch up with what it's going to cost and understand contracts. Like that's scary to me to think of seniors trying to, or even retiree age.
it's really scary, and it's hard because we're ever changing. So by the time, Mindy, you get to the age that you would need to use that, things have so drastically changed that half of that doesn't even count. At least my experience and looking at tons of insurance policies, you know, I'm like, well, the big piece, especially with assisted living, so of course it's quite easy when you're in a skilled nursing facility because a lot of those policies are geared around skilled nursing, a skilling factor, okay? So that's what they were more set up for. But they weren't so much with the assisted living because that's fairly new, you know, like in assisted living. So I worked very hard to jump through the hoops to make sure that their insurance was still gonna pay because they had the skilling factors that the contract talked about, but it was under a different license. They didn't love that, but they did it because these people have been paying thousands and thousands of dollars into these policies. So I think that for advice is to really take a look at their coverage as far as medical care, and if they're really specific to actually diagnosis and things of that nature, then that's not really safe because right now we're dealing with dementia. Back then, when all these folks got these policies, that wasn't that common. So they're not built into these contracts. But you know what? When you get older, there might be something totally new. So those words need to be sort of broad. And then you also want to take a look at the cap. So a lot of these insurance policies will be capped off at a certain cost. And so what you'll want to think about is, that looks really nice right now. You know, if I had a cap off of $500,000, that looks like enough. That would take care of me for a little bit. But will it when you get older? So we really have to be looking, those would be the main points that I would say to look at if you were going to get an insurance policy, if that's what you want to. And then I would also say make sure that it wouldn't be exclusive to a facility, as I think that we are going to be evolving out of facilities and into maybe other things like pods or like community living or hopefully just staying at home. I wanted to open up a question to you. I see that you had raised your hand earlier.
I'd like to know a couple of things. How do the people get a hold of you, and what are the qualifications?
Those are good questions. So you can just call us, or you can get on the web and find us. And there are no qualifications because we're a private pay organization and we're just a physician practice. You can use Hestia at any time. So we have many levels of care that we provide. So if you just needed somebody to help you, occasionally, to you needed 24-hour care, we can do everything in between there. So we're not like home health, and home health would be something that was a medical need, like wound care, and your physician writes your prescription for it, and then the nurse would come to your house and do wound care until the wound was better, and then the nurse goes away, home health goes away. So that's what home health is like. And we're not like home instead, which would be carers in the home, and they can't do anything medical. So they would have caregivers that could come take care of you at home, and they can do things like meal preparation, house cleaning, but they couldn't do anything that would require medical attention. So they couldn't help you with your meds. They wouldn't have a pharmacist that could come into your home. They wouldn't have a nurse or a physician. So, in that way, we're sort of different than those things. So, we're the only thing like Hestia in the nation. We're the only one that does what we do. We're just really unique in that way. And I think it's a really great model because I think it answers a huge need in that unique way. But if you haven't had a pear, you don't know what a pear tastes like, and it's not like an apple. I mean, it's so hard to describe it unless you've had a conversation or tried it.
And so what if you run into situations where children have power of health and power of attorney and all that kind of stuff?
Uh-huh.
So, if your child has a power of attorney over you, that won't actually be effective unless you want them to go ahead and assume those responsibilities and you're like, oh, they're going to make those decisions, or if you're deemed incompetent and you can't make those decisions. But otherwise, as long as you are cognitive and you can make sound decisions for yourself, then they don't have the ability to utilize that power.
But they could also choose Hestia for you.
You may be looking at a court battle.
That's true. That can happen.
You gotta be real careful how you draft those things. Get a lawyer to do it.
Yeah, you're absolutely right.
What specifically would be your concern?
Well, I had a situation where my husband was sick at really at the end times, and his oldest son was a doctor, and also he had power of health and power of attorney. And he called me and he said, we're coming to Montana to do the hospice the way we do it in Denver, because it's more humane. And I'm like,
Denver's pretty progressive, wow.
and it just really took me back, because though we didn't have hospice up in Polson at the time, you could not have had better care than what those women were, the home health nurses were giving him. And it really, it's one of those things where they were stomping on him, on them, and that really upset me, because they gave him such wonderful attention, and even Dr. Beatty was just wonderful with him. And somebody be that obnoxious is what I call it, and uncaring about really looking into what really was here and how that he was being taken care of,
Right.
So I just wondered about if a situation comes up like that, I don't know, but.
And I think that speaks really clearly to why it is so important to have that conversation earlier, before you're in a crisis. Because a crisis is going to bring the stress out of whatever situation you're in. And if you've already had that conversation, he's been able to have it with whoever he's chosen as his power of attorney for healthcare, but then also that the whole family understands what his priorities are and who he trusts to take care of them. And I think it's that distance apart that if you're not here, you can't really see what's happening. If you're not here, you can't really see what life was like before this diagnosis and before I wasn't able to do these things. So when I want to say I want my life preserved as I've always had it, which has been with you, but they haven't remembered him since back in his strapping days when he was able to do all of those things, so independently. And so there's just this big unknown area between you guys. And I think why we encourage families to keep talking and having these conversations is to take some of those unknown factors out. So you might not be able to say what diagnosis I'm going to get or what the situation's going to look like, But when you're watching a movie and something really difficult comes on, you know, that's the opportunity to turn to whoever you're with or your family and say, if that was us, this is what I would want you to do for me. Or, you know, sometimes people get in crisis moments and they're afraid to make a decision because they don't want to shake anything. And if you've already talked about it when you're not in a crisis moment, that makes it a little bit easier to fall back on what that looks like for everybody. So I think more communication earlier ahead. Everybody hates worst case scenarios, but if you've gone through it and explored it and come up with next best option for what you want, then it's done. And you don't have to talk about it all the time because you've already been able to go there a little bit.
And I understand what you're saying, and I appreciate that, but he knew what was going on.
And they were still.
And he was still this, you know, I just didn't understand it at all. I mean, I don't know what else I could have done to take care of my husband, and I mean, two of the family were there one time. I had the home health nurses. I had Marcy, who is someone who trains caregivers to come in. I took him up to the assisted living just in case something happened, if he had to go up there. And I would take him up to see Dr. Beatty, they knew him, everything. And I'm thinking, if they take any better care in Denver than they do here, I would really be surprised.
Right.
Right. I think that that's an interesting thing, and it happens so frequently. And it really, I think, highlights the need of the person that flies in, you know, that hasn't been involved much, much more than the person who needs the care, right? Because they are trying to cope with something that they don't know how to cope with. And their way of doing that is to impose and control something that they can't control. And that's sad. It's hard to watch, and it also makes families really it gives you an uncomfortable situation that you can't deal with. But I don't think it was a negative reflection on what you were doing, clearly, or what the situation was. It was what that person was struggling with. And I think that part of what, you know, systems like Hestia and Hospice are designed to do is to help the family work through those things. You know, to have a life coach or a social worker, or that psychosocial piece that not only addresses the patient, but also looks at the family dynamics and helps to support that, and can really put those things on the table and not just say, like, you did this and it's really bad and I don't like it, or you're not taking care of my dad like I want, or this isn't like Denver, or, you know, just to put on the table, like, this sucks, the whole thing sucks, right? And we haven't talked about it before, and I bet you feel like this is hard. I bet you feel like you're doing the care that you think you should be doing, but like, how now can we do what's best for the person who is suffering or is going through this experience, you know, and take care of each other? Because really, I think that people want that. They just don't know how to do it because they're reacting rather than being thoughtful about it. And that's why programs like Hestia and Hospice are really great in those situations, because we can be on the outside looking in and dissect that in a way that is meaningful. And I think that we all will need that. And when I go through that with my family, I'll need someone to do that for me. Because you can bet I'll get caught up in the family dynamic. Probably one of my siblings will fly in, you know, or I'll fly in and try and control. I mean, we'll all fall into those roles because it's human. You know, that's how we are.
And it's based out of fear. So that's why we're encouraging conversation. So the more comfortable you start getting with these different processes of life, it eliminates the fear. But what I'm hearing when you said that, I'm hearing that son was really fearful. And because he had a great knowledge about the medical field, he wanted to assert himself, like Marika was saying, so that he felt like he was doing his part, but maybe not listening to really what was being said. So it comes from a place of fear, and so that's kind of why we want to do the whole vision. So we have our mission and what our goals are for Hestia, you know, right here in Missoula, but we also want to get a voice out to say, let's not be so afraid of these topics. Let's talk about them, because we're hoping that that starts to break down some of this tension, because people hold on to ideas of the way they want it to be, or how they want it to go, or what their responsibility is in particular situation, and people react instead of respond. And so then there's sometimes chaos and messiness and hurt feelings, and it's not really a good time for it. You know, it's not a good time for it.
I find that the common denominator is love. When the families don't agree, the one common denominator is love. You loved him, and his son loved him. And when you come together, that's the common denominator.
I can understand that.
Yeah. It's just how his son showed love.
Looks different.
And how you showed love. And when you get one person there that can see how you loved him, and another person who can see how the son loved him, and that one person can bring you two together and see that you loved him, and the son loved him, then things can happen.
Thank you.
A related question is some legal things. And do you encourage these people to update their will or to create a new one in the first place?
Yes, and I want to be written into everyone's will. That's my goal. Yes.
Keep smiling.
This face, remember it? No. Yes, we do. And we have a lot of resources in our community to do that. One of the people that we really recommend are Brian and Kathy Derry. They do kitchen table conversations. And that's not specifically around wills, but they definitely teach people how to have conversations with their families about, you know, difficult things about aging or end of life, or doing things like, you know, telling your father that he needs to have a will without making it look like you want to be in it. And, you know, that's hard. And it isn't because I want to really be in it, it's because I want him to plan so that something happens that is what he wants. And that's something that they do really well. But then also, Missoula Community Foundation does Willapalooza, which I think is really great. And so they have different attorneys in town that will come and give free advice. You know, and they do that twice a year. And it's at the Missoula Community Theater, so that's a really great resource that you can just sit down with an attorney and ask, you know, I kind of have a will maybe, and I haven't updated it, what should I do? So we want to connect people to resources like that and make sure that they, you know, are doing what they want and have updated wills. Definitely.
I think that the big, like my big mission for everybody would just be, have it be a proactive conversation instead of reactive. I think just as I'm listening to that, and you don't know exactly what it's going to look like, but the more you're able to proactively talk about it. And I think it's going to continue to be more mixed families. You know, this year's census was the first year that the nuclear family was actually the minority. Like, it's not, most families are not that traditional unit that we've been used to, and that people that are passing away now have grown up in. So it is going to be more complicated with who loves who, and who's the power of attorney, and who's, you know, I think that that's going to be the new normal. And so I really appreciate thinking of that common denominator of how to navigate that together.
And the 5-bedroom house you were talking about, part of the problem.
Yeah.
That families are not together, or if they, so often I have a number of friends who are taking care of their parents. There's one child in a family of 3 or 4. There's one that has all the responsibility, if you will.
Right, and
because
they're
they
written
live
that
here.
they didn't move away. Right,
Yeah,
I know.
yeah, I mean, things fall apart very rapidly.
Yeah.
It's a horrible stress. Having someone like you that can support the caregiving family is just huge, because most of them are out there all by themselves struggling.
Right. And I guess that's part of, you know, what we have talked about, the idea of being just sort of that family when the family can't be there. Because I don't agree with people that families should stop moving away, right? Because my brother lives in Qatar, right? He's in Doha, he's in another country. And I celebrate that for him, I think is awesome. And I know that if my parents needed help, or if I needed help, he wouldn't fly back to take care of us, but financially he would make sure that something like Hestia or another program would be a place to do that. And that is a way of caring too, right? So that he would have the peace of mind that that was happening. And I think that that's just another way of caring, right? To send in someone who can do that and communicate back to you, make sure that you feel good, that your family is, you know, cared for in a way that you would find meaningful also. I mean, I think that that's very, very beneficial.
That's another question that has really came up for me in being able to observe elderly care and how that looks and how different it used to be, where people would have that whole family dynamic, and that everybody would be there and everyone would take care of each other, and that's just kind of how it rolled out. But now that you have both spouses working and they can't take care of that grandparent or that elderly person, there's a psychology with that elderly person that they haven't let go of. And I know that's always it's a little controversial for me to talk about it, but it's that piece that that elderly person has saved their money so that they could give it to their children at the end. But while they're saving the money, they really need to spend the money on their care. And that's the piece that's changed, because we can't take care of our elderly like we used to, where we would actually be able to be in the home with them. So now, but the psychology of those folks is still to make sure that they give their kids money. So then they are denying care for themselves, or saying, no, I don't need that, that's way too expensive, because they really want to give this money, this chunk of money, their little egg nest, to their kids, which is really noble. But at the same time, it's sad, because I see these people suffering and going without a quality of life because of the mere fact that they want to give money to their children when they die. And so I say strike a balance with your life. You struck it when you were younger, you struck it in the middle, strike it at the end, and make sure that if you need those funds for your care, you've loved your children. And that was enough. I know that I would never want my mom to give me anything. She already did by loving me, and that is all I ever need. So that's where we're also changing. And we're, and these folks now have to start utilizing the money that they were going to pass on for themselves. And that's a psychology that's really hard to break, and it's really hard for them to be okay with that, because they want to be able to give some money to their kids. But really what I also see is generally the kids just want the parents to be okay and to be taken care of, and that's more important. So having these conversations, hopefully, to get people thinking about the fact that it's not the way it used to be, and we are changing, and so we need to really start thinking about some of the old ways and letting them go.
Would you try one more time to clarify for me the difference between Hestia and a quality home health program? I understand the wraparound services and the advocacy and things like that, but in terms of the day-to-day care in the home, how are you different than the other agencies?
When you mean a quality home program, do you mean like Home Instead, or?
No, I'm not going to name names, but we have several good.
But like that sort of service, where you have just caregivers that come into the home. So.
Well, no, the ones that have RNs on staff and do home visits and stuff.
Well, if you have an RN on staff, that would mean you're a home health agency, right? So like Nightingale Nursing, and you can privately pay, or you can privately pay. So you can privately pay for a nurse to come in your home and do that, which would be Nightingale, and that would be a nurse and maybe a CNA. And you can also have something that would be just a caregiver that would come into the home. And those are also both good models. So I don't think that they don't have a place, and I don't think that there's anything wrong. We sometimes refer people to them too. And maybe they will coexist with Hestia at times as well. But the difference would be that they are not a medical model in the same way that Hestia is. So we can provide much more encompassing care and long-term care than a program like that. So we can really help someone age in place and then build a team around them as they need it. Whereas a program like that will reach a place where they'll have a breaking point, and then you'll have to layer on another team, or you'd have to move or have hospice. So we wouldn't be as siloed. But you could definitely stack on different programs to have sort of what Hestia does. It's just that we're all under one roof.
Don't they have to be homebound also?
Yes, and to have home health care, you have to be home.
That's true. And are you going to move people on to hospice, or are you going to provide full hospice care when people are at that point?
Hospice is something that's covered by Medicare, so that's a benefit that you've earned. You can definitely have hospice when you qualify, and luckily
You're not going to do hospice.
we don't do
You're
hospice.
not going to bill.
Rush, no, we're not hospice. So we would refer someone when they were appropriate for hospice care, and you can do both at the same time if you'd like, because we're private pay. Or if they had everything you needed, then you could certainly just do hospice.
I just think it'd be a loss to have your team develop the relationship and then move them over to hospice, that's what I was.
Right, and I think that there is a place where hospice can't be a caregiver, right? So hospice can't take the place of a caregiver in the home. They're hospice and they're doing end of life specifically. So if you had, like with Hestia, worked up to, and then we have many levels of care, a level of care where then you were on hospice, you could come down to a different level of care and then be receiving hospice at the same time. So you would have a consistency with the caregivers that you had with Hestia, and then you would also have hospice filling that need at end of life. I mean, there are the experts in that, and that would be really great, but then you wouldn't lose a team, which would feel weird, you know?
That's what I was,
But then you could also stay at home. But if Hestia went away, most likely you would have to hire in other caregivers or move then.
Mhm.
So we could do that together and we would do it well, which would be great.
Because hospice can't ever take the liability of being a caregiver.
Yeah.
I mean, hospice can't take, I mean, according to Medicare, we cannot take the liability of being the caregiver.
Yeah.
So, you know, like if, for instance, a patient said, we need hospice to come in and deliver this patient's medications every day, you know, like every day at 8:30 a.m., Monday through Sunday, you know, and give them all of their meals, that wouldn't be something that we could do, because what if, you know, what if our nurse had a death before that and we couldn't get there until, I mean, that person would go without a meal. I mean, you know,
No, I understand.
we're not there to be the caregiver. They have to be able to be their own
but most
caregiver.
people in the home that are dying have a family person to
Right,
to do
most
things.
do,
Yeah.
not all do.
Not all,
Not all do. And some hospices won't take up a patient if they don't have a caregiver in the home.
yeah, they really can't.
So,
I don't expect your workers to work for nothing. Where do your resources come from?
Well, we pay them.
Hmm?
We pay them.
Where does the money come from that you pay them with?
We are private pay, so the families that have our care pay us. So we aren't funded by Medicare. So either, if you had our care, you'd either pay us privately to do that for you, or you would have a long-term insurance care policy that would pay us to care for you. So that's where we are funded.
Okay.
Yeah.
Do you have any grant funding?
We don't. We are a for-profit organization. We are also starting a nonprofit, so there will be the Hestia Foundation. And our goal is to provide care to 10 people per year for free. That's just something we're starting, so that will hopefully start next year that we are able to do that. So we will be fundraising and doing that on the nonprofit side. So we'll have both, which would be great. Yeah.
I'm wondering how people are responding to the physician piece and how great that is. Oh, I'm giggling. But
It's so, I don't know.
As you described it, it made me think of the model of hospitalists in the hospital, where we're used to having our own doctor. And so if we're hospitalized, it's not as if our own doctor's replaced, but while we're in the hospital, we have this other person in charge of our care. So it seems like it's sort of similar.
It's a question that comes up a lot because people think that that means that we're going to take the place of a physician, and that we don't. So our position would be just a specialty physician, sort of, if you have your primary care doctor, family medicine, and then you might have a cardiologist. There'd also be an ER doctor. The difference is that our doctor's job is to take all those other providers' information and gather it for you and then give it to you in a way that's understandable, and then follow your care, which is what family practice doctors used to do, right?
Yeah.
Like your doctor used to go with you to the hospital, and then when you were in a skilled facility, they'd also visit you there. And they probably maybe, gave birth to you when you were born and knew you since you stole things from the good food store or whatever. I mean, I don't know. But they knew you your whole life. And so they'd be like, yeah, Lisa, I know, that time you broke your knee in 3rd grade, that's still bothering you, right? And so that's something that your provider knew. And our goal is to know you that well as well. And granted, we're gonna catch you later. We're not birthing people in the home, but we want to get the whole picture and know that well, and then to follow you as well. So we will also be the liaison with all of your other providers. So when you come on to service with Hestia, our provider will talk to all the other doctors and say like, hey, this is what we're doing in the home. We'll always send you a report when we go. If you ever have questions, call me, so that we can keep them updated. And that's something that we have found. We had a patient that did end up going into the hospital, and then she did pass away. She did have a family practice doctor, and we were the first person to tell them that she had died.
because
So typical of our healthcare.
right, they didn't know,
Yeah.
and it's unfortunate.
But
it's
aren't the primary care docs gonna say, okay, we're delighted that you're taking care of Mrs. Jones and leave us out of the loop?
Sometimes that is how it goes, and I think that that's really similar to hospice. Sometimes there's like,
Oh, yeah,
perfect,
hospice
thanks,
does
we never
it
want to
all
hear
the
from you
time,
again.
Yeah.
And sometimes they're like, I know Mrs. Jones since she was 20. Please let me know what's happening.
Yeah.
I haven't heard from her for 5 years. I wonder how she's doing. And then also some providers are saying, they've called a lot, they've had home health. I feel like I'm doing a lot of work, but she can't get into the office. Like, thank goodness someone will be seeing her in the home. Update me so that I can be a part of that team. I know her. And then they're really valuable because they do know her really well. And that's great. We love it.
And Mary, just to tell you, as we are
Why we're giggling?
orientating ourselves in the community with Dr. Peterson Hale, it is such a fun experience to be a part of this and to see the actual so watch the community interact with a doctor, not in a doctor's office, not in the hospital. It's really remarkable. It's almost like a surreal experience because they get to talk to them just like two human beings and be real, and they get to continue to ask questions, and the doc isn't, running out because they have to help the next patient, and so you just see them kind of light up and sit up a little bit taller, and they're really paying attention to me. They really see me. And I didn't expect to witness that. I didn't expect to necessarily see that while all of this was transpiring, but that's what I saw, and I was like, that's magic. That's wonderful. So it's really exciting.
That was really fun.
Is that the emulation of the house call that we used to have in our town?
Yeah.
Absolutely.
So we did a presentation similar to this, but Dr. Peterson Hill was fortunate enough to be there. And a lot of the people, that were participating were aging and they needed her care. And she's so great. I mean, she's so down to earth and wonderful. And it was really fun to watch them talk to her. So that was another thing we got to witness, was her just saying, I'm just from the big hole. I'm like a pretty ordinary person. What kind of questions do you have? It was just cool. She's really neat.
It was also really neat to hear the doctor's perspective about how nice it was to be able to spend that type of quality time with people who were inquisitive or had questions, because that's something that I think that doctors don't get a lot of. It's not that they don't necessarily want to spend that time, but being so regulated, sometimes they don't have that opportunity. And so that was really fun to see our medical director be excited about connecting in a way that reminded her of why she's a doctor.
And to see them in their own space, that must be just a treat.
Yes, and it was really great to read the notes, and she was extremely detailed, and I could tell that that was something that she took into account, that she really scanned the environment, because all of that stuff really does communicate to a doctor how someone is or isn't doing.
And the research shows people learn better in their own homes. So they're not intimidated because they're not in somebody else's environment. They learn better. They, of course, will ask better questions.
Sure. Yeah, they absolutely, they learned a lot about the patient because the patient was more open and more comfortable, like you were saying, Kit, in that setting. So it was really fun. I mean, the notes entailed a lot more than I've ever seen a doctor's notes entailed. And it was actually kind of fun and humorous, yeah.
Maybe we should bring back the house call. I'll share this just because this day is special to me. I was born at the NP hospital tonight at 7:44 p.m. in 1950. Happy birthday! And all of my life, I had the same pediatrician, and that was Dr. George Barmeyer. Actually, Dr. Brewer was my attending physician at my birth. Wow. And all my life, the doctors came to our house. And it wasn't like they did it regularly, but I remember when we had measles, when we had chicken pox, when we had, my father had a hernia operation in his 20s, 30s, and there were always house calls. And you know, we went to the hospital and then they built St. Pat's. And we were patients there. And after that, still, he continued to come, both doctors continued to come to our home. And then when I was in my first apartment, I was living on East Spruce, and there was a German man who lived in the upstairs apartment from me, and for days I was hearing this moaning like a dog, and all of a sudden I realized, oh my God, it's Martin, I've got to go up there. Well, Martin was trying to pass a kidney stone, and he didn't speak English, and he was a prisoner of war here for many years. And so I called Dr. Brewer, and he was, you know, he passed away at the nursing home out here at Village at 105 or something, so he had a long life. But he was in retirement already, and I called him, I said, Dr. Brewer, could you please come and see this man, because I know he won't go to the hospital. He came right over, he went up there, and without speaking any English, he determined, well, he's trying to pass a kidney stone, and he really should go to the hospital. But he won't go to the hospital. I said, oh, no, I know that. He said, so I'm going to come every day. I've given him something to take, and maybe he'll pass the stone if we're lucky. And he did, and so that was all resolved. But that was so many years. That was 45 years after I remember him being at home, and he was still doing house calls.
Wow.
Well, that's our goal. I mean, that really is our goal, is to change medicine, right? But bring it back. It's not a new idea. It's just something that worked, and it, you know, is really valuable. Yeah.
Well, and the insurance companies and Medicare are beginning to understand that. One of the reasons we don't have house calls, or haven't had house calls, is getting reimbursed. We've had 2 docs here in town in the last 7 years that tried to do home visit practices and just not been able to make it financially viable. But they can now. You can bill for home visits. So
yeah, I think there are some physician concierge, you know, practices that are really what you're talking about, that have found a way to do that. Yeah, it's valuable, and you know, that's something that, you know, we've been looking at, because to have a membership, you know, that was a minimal monthly payment, in order to have that would be really reasonable. You know, then it would be a sustainable program.
Well, in some of the big cities, the concierge services are not a few dollars. You pay a bunch every month to have the privilege of a 24-hour doctor. And
Absolutely.
Each doc has a very small panel of people that they exist just to serve.
Yeah, that's very true.
It's weird.
It's wonderful. I love a doctor to come to my house. I was trying to talk a surgeon into doing surgery in someone's house the other day. I'm like, why not? I'm like minor surgery. I'm just talking about like hemorrhoids or something. You could do that. He was like, absolutely not. I was like, fine, whatever.
Even more useful is the 24-hour phone access, and, you know, getting your scripts renewed quickly, and you know, the little things that make a huge difference to busy working people.
Yeah, I mean, that's one of the other pieces about Hestia that we really like, and Hospice has the same thing, is that we have access to a pharmacist 24 hours a day. You know, that's another member of our team that will go into the home, do in-home med reconciliation, which means they'll go into your house and say, like, are you really taking all these things or not? And in my house, it'd be like, no. And then they can get rid of the medications you're not taking, package up the ones that you are, and deliver them back to you. And then you have a list of what you're really taking to take with you to your doctors, which would be really helpful to a lot of people, and also helpful to their providers and the emergency room doctor. So, yeah, great.
So, I'm just curious if you would like to talk a little bit about your article, 60 being the new sexy.
I just want sexy to be a word that's not a physical thing, that's all. So my daughter, of course, challenges me to grow as a person all the time, and that was a really funny conversation to have, and it really reminded me about aging, because I think that a lot of the things that people do to care for their families is, to me, very sexy. And it's not sexy in a way of like, I want to make out with you. It's sexy in a way of like, it makes my heart feel good, and it brings me to a place where I think I want other people to see that, and I want other people to start doing that. And that's what I mean by sexy. And of course I got calls from people that are like, I have this great book about having sex after 50. Are you going to talk about that? And I was like, no, that's not the point. That's not what I want to talk about. I think it's worth talking about. I'm not comfortable talking about that. Other people can talk about it. But that's something that I think we could really establish, is to look inside people and the things that they do for other people at every age, and that doesn't stop at 30. It doesn't stop at 20, really. It goes on until you're 80 and 100, and we'll be blessed to see those ages and to accept each other at those ages. So yeah, I'm sorry if this wasn't the sex talk you were looking forward to.
Love letters?
Love letters are also wonderful, yes. So that was something that that my dad does for me that I love. So a year ago, my father asked me what I wanted for Christmas, as he does every year. And whenever I ask my dad what he wants for Christmas, he always just says a happy family. So it's hard to buy him a Christmas present. Although I love to be happy, so that's easy. But one of the things I asked for him was, I don't want anything from you except for to know you better. And it would be great if you just would write me a letter every month that would detail your life, so talk to me, write me something about as you grew up. And he is an amazing writer. He's an English major, and we write the same. He taught me my handwriting is the same. And so he's done that, for the last year. Every month I get a letter from him that talks about as he's grown older, and that's a love letter to me. It's beautiful, and that is kind of sexy. And it's something then at the end of the year, all my siblings wanted the year of my letters from my dad, because they knew that was happening, and it was something that they really wanted to know as well. And he's doing it the next year. It was ironic that in November, which is the 11th month, he had gotten to age 11, and it was just a beautiful thing. So those are the greatest gifts. It's not something like a pair of socks, which I also love, but I can continue to read those letters. It's beautiful.
Another one, one of my daughter-in-law's fathers turned 70 last year, and they had a huge family. There's 7 kids.
Wow.
And my daughter-in-law got everybody in the family, the kids, the grandkids, everybody, to write a little thing about what they knew about Bob.
Oh, so cool.
And she made a book out of it, and it is just the most beautiful thing to read. I just want to,
Right? I mean, it's those things that sort of move you in a place internally that are the most valuable, and somehow I feel like we sort of gloss over those on a daily basis, right? Like we aren't saying hello to people really. When we ask someone how they are, we're like not meaning it. And I know that we're busy, and I do those things too, but it is valuable. Those things are amazing.
I don't ask unless I want to know the answer.
Right. And then when someone asks you, like, here's the thing. How much time do you have? Yeah.
I think that's something that's really unique about me being in healthcare and being young and learning about death and dying or chronic illness or just the aging process. And I had this idea that I wanted to make the aging process, death and dying kind of trendy, because you know how you get like all these trends of like gluten intolerance or like chia seeds or just all of these different trendy
The
things
Thigh Master.
that are healthy for you. These are things that are healthy for you. I can't think of them all because I don't necessarily jump on the bandwagon, but I do observe. But I thought, as I've really gotten the process of aging into my spirit, I watched it change who I was, and it made me more healthy because I understood what they were talking about as I sat there with people when they were on their deathbed, and I would listen to what they thought was important, and it put me in the moment, and it made me more present, and it made me more aware, and it helped me to understand what is valuable. And it slowed me down and got me more in touch with something that I probably wouldn't have experienced unless I was on that deathbed. And that's a beautiful piece, and that's actually, I think, the piece that should be in every health magazine, because if you focus on death, you will improve your life, because you will understand that you don't have that long to live. So how do you want that to be? What do you want that to look like? And knowing this part reflects all of this. So how you live your life is how you will ultimately have that end process look. It reflects your life. And so I was like, well, I don't want to get that disease. I don't want to do this. I don't want to do that. So that means I need to create balance right now in my life. And it created that awareness for me. So having an awareness of death and talking about it, and or any chronic illness or just the aging process, really helps you to wake up. So I definitely think it's sexy in that sense.
Yeah. We're gonna make aging so cool. I need all your help, because I can't do it by myself. Right, I mean. Thank you guys so much for coming. We do have an ambassador program. If anyone wants to sign up for it, you can. So you could give us your input.
Are we gonna hear Mary play the harp?
Yes.
Only because we need a ritual. I was so touched by your talking about your birthday, so we're going to sing happy birthday to you. And then I'll play a little while everybody breaks up and visits. This is Ellie.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Ellie. Happy birthday to you.
Thanks for sharing your birthday with us. That's really nice.
Thanks for
Yeah.
happy birthday.
You said 7:44?
44.
All right, we got 3 minutes.
Yeah. That's really cool. I've always
If
liked
I go
harp
off in a
music,
little
but I've never
booth,
heard
you'll
it used
understand
to
why.
play something useful. Yeah.
Sturgeon.
Yeah.
What a nice way to celebrate.
Thank you.
It's for the party and all the information.
It's a party in your honor. Your honor, your honor.
Well, thank you everyone for coming, and please contact us if you have any further questions or are just interested in learning about our community. Maybe what we can do.